In about 7 months, our patients will be able to enter our new emergency department. They'll check in here at our registration desk and be escorted to either side of the emergency department to receive care. On one side of the emergency department, we have 4 exam rooms. The first room here would be our triage room. That's where our nurses will do a first assessment to get patients to whichever area they need to go. This is another one of our exam rooms. Most of our exam rooms will be very similar. They will have the basic care that's needed, including medical gases and other types of equipment that will allow us to care for patients in a very coordinated and efficient area. And this is the final exam room on this side. This area in the middle, right now it's kind of a storage and work area, but this will become our nurses station. We have designed the emergency department to be in more of like a racetrack setup, which means our nurses station will be in the middle and all of our patient rooms are around the outside of the emergency department. This will allow our staff to be able to visualize each patient room and be able to more efficiently provide the care and services that our patients need. We'll have a small nourishment area here, which will come with a coffee area and ice and some small meals for our patients as they're needed. With our new emergency department, we're going to be able to offer something we just haven't had the ability to do, and that is to have several rooms that can be designated for individuals who are maybe having some mental health issues. They may need some direct supervision to make sure that we're able to keep them safe. But these rooms will be designed to ensure that we have the best environment to care for these individuals who are really struggling at the time that they come to see us. We do have something that we also have not been able to have in our facility before, and that is an inside hazmat decon area. Right now this is serving as our ventilation room, but in the future we'll be able to bring individuals who have maybe been exposed to some type of chemical at their workplace or out in the community, and we'll be able to quickly get the chemicals off of them and then bring them into the facility when they are clean and ready to be cared for. Our new ambulance area is right off the outside of this door. Patients will come in by ambulance into a garage, and each ambulance will be able to pull through. These 2 large rooms back in this corner of the emergency department are our trauma rooms. And these areas will be specially outfitted to care for fairly serious conditions, whether it's a trauma or it may be someone having a heart attack. But we'll have all of the equipment and services that are needed right in these 2 locations. This area right in front of us here is where our physicians and our nurse practitioners and physician assistants who care for patients in our emergency department, where they'll be located. They're right off of our nurses station, so we'll have an opportunity for incredible communication and also an area where they can monitor patients and complete their documentation. The rest of our emergency department is primarily areas for storage, our soiled utility rooms. And right now we're in an area that is where we connect to the building. So on the other side of this wall is our current walk-in clinic. In the future, these will be additional service areas, more likely staff areas for our emergency department and other shared workspaces. As we walk down this hallway, you can see we're able to bring some natural light from the outside. That's something we're not able to offer for our staff in very many locations in our facility. This is the first area where they started the construction, so as you can see, we're much farther along. Not only have they topped out the sheetrock and provided insulation, they've also sheetrocked the interior of the walls. This room here will be a staff break room. It'll again offer our staff the opportunity to have outside lights as well as a private place for them to have their lunch or to just get away from their department for a while. And further down this hallway are more of our shared spaces. This room here is an area where our ambulance department will have some office space, as well as a lot of the equipment and supplies that we need for our ambulance services as well as our emergency department. In this area, we have a suite for our ambulance team. We'll have 2 large bedrooms on each end of the suite. They'll be able to accommodate 3 staff people at one time. We have a private restroom and bathroom showers in this location, and then we'll have work areas as well as areas where our ambulance team can relax. Our ambulance service is 24/7 for our shifts, so this gives our staff an opportunity to have downtime and to be able to be ready for the next call that they have. As we reach the end of this corridor, we're able to get a better idea of how we'll connect to the hospital. At the end of this hallway, if we continued through those doors, we would be at our radiology area. It connects to where our CT machine and our MRI are, as well as our x-ray rooms and other services that we need to transport patients. You can see a lot of the ductwork has been completed in this area. Out there you can see our new ambulance bay. The new ambulance area will be much larger. All ambulances will be able to pull directly through. Currently they have to back up out of some of our ambulance doors. It'll also be longer, which will accommodate diesel trucks, as well as in the future trucks become larger or change.